I'm with Dr. Teresa Frankovich, Humboldt County Health Officer, and here are this Tuesday, March 31st media submitted questions. So can you tell us more about what does community spread mean?
Sure. So in the past, we've been reporting on people who had contracted COVID because they had traveled to an area with it, or because they knew they had been with someone specific who had been diagnosed with it. Community transmission means that in the course of our investigation, we have been unable to find any link to a known case or any travel to explain the illness. And for that reason, it alerts us to the possibility, and at this point I think a certainty, that there's low level of transmission occurring within the community that just has not been detected to date, as we've seen in communities across the country.
So now that we are seeing the community spread, how does that change the criteria for COVID testing?
So we're still continuing to test. Basically the testing and the positives that we're getting right now does help us to do two things. One is it helps us to track the outbreak, and so it gives us a real sense of how quickly we're identifying new cases, how fast that may be occurring within the community. And then it also allows us at this point to still do some contact investigation, reaching out to individuals, quarantining individuals, and then as this grows and we have more cases, doing extensive case investigation for each person will not be possible. We're a small health department, and bigger health departments than ours have had to move on because of resources as well. And what we'll do is we'll shift to sort of a contacting people, educating them about their risk, asking them to remain at home, that type of thing. And then at some point when the virus itself, when we have indications that it is widely occurring, and those things occur certainly when we know that it's as likely as not, if you come in with a respiratory infection, it's COVID, there's no real role for that anymore.
Okay. What extra precautions should people do to protect themselves against community spread?
Well, I think we've been really trying to emphasize to people that they should look as every time they leave the house to do their essential activities is a potential contact with someone who has the infection. The CDC is now suggesting that even as we're identifying cases and contacts, we look at even the period a day or two before they became ill as a possible time for transmission. We know that transmission in people who are not having symptoms is likely not as efficient as it is when you're coughing and sneezing and that type of thing, but it can occur. And so what I want people to understand is they can't trust that the person next to them who is not coughing is not infected. And so we're recommending that people, A, limit their activities outside their home, B, they do all that really good hand washing and such that we've advocated, because that decreases the risk of them inoculating themselves with the virus if they've touched surfaces, cleaning surfaces. And then I think what we're learning now with this outbreak is that there is some value to masking for community members. I think that it is obviously it's not a perfect barrier to infection. It's not meant to allow people who are ill to go out and about, but it can help those of us who may not yet have symptoms prevent spread and expose other individuals near us. So I think the use of homemade masks in individuals who can tolerate that based on their respiratory status and such can be a useful tool in this outbreak.
In the updated shelter-in-place order that came out yesterday?
Sure. So I think a few things. One is that it does define the high-risk categories for individuals more broadly. It gives more definition to that, and that is taken directly from the Centers for Disease Control and Prevention guidance. So it helps people identify themselves on that spectrum a little bit better. It also has guidance about parks. In spite of the fact that the original order did in fact say that playground equipment, things like that, are not to be used because they're communal surfaces. Certainly that was occurring, and so we're very specific about that in this instance. We did not close all parks. However, certainly what we're emphasizing this is that people are not to congregate in parks. People are not to be playing team sports in parks. It defeats the purpose of what we're trying to do. Then there are certain parks that, because of the way they're structured, are closed by their local areas, and that is that is not changed by this order. So again, social distancing in those parks, no use of communal equipment, those things are important. And then I would say the last thing that's one of the bigger pieces of the change is the idea of rentals. Hotels, motels, vacation rentals. The goal of the rental being to draw people in from out of the area, vacationers and that. This order really addresses that and says that is not acceptable, but recognizes the need for essential workers and such to have lodging if they're coming to help in our area. And so I think it's an important tool we can use and addresses concerns we've heard from the public too about this, and provide some additional guidances for those businesses.
Okay, and what if you don't know if your business is considered essential or not?
And I get that. Some things are very clear that you can easily tell on the order. Some things may not be as clear to individuals. So I think calling our Joint Information Center, that number is 441-5000. Someone at that number can help you figure out if your business would be included or not. If they don't have the answer, they know who to contact to find out for you.
And just to go back to the outdoor activity for a minute, it's not okay to congregate in parks or use that equipment. What outdoor activities are still approved?
So, again, fortunately, we live in an area where people can access the outdoors. So going for a walk, and going for a walk with your family unit is fine. The people who live in your household, that is fine. But not joining others. So if you normally jog with a group, that is not acceptable anymore. If you normally bike in groups, that is really not acceptable either. In the sense that we are really trying to maintain distance and not assemble people who would not normally be together. But biking, hiking, walking, those things done either with your family unit or individual are all appropriate.
Okay. When do we think the pandemic is projected to peak in Humboldt County, and do we know how many infections we'll expect to see?
Well, it's the really million-dollar question, right? And what I can tell people is it's early for us here yet. We're developing models based on sort of some standardized models that are out there in the public health arena, as well as looking at the experience seen in the Bay Area in California, and then comparing that with our own population. So I think right now, as we're constructing these and kind of looking at what makes sense for us, I think we're still in that more preliminary phase in terms of, there's no way for me to tell you today the date that this is going to occur, and a projection that we set today for that may have very little meaning a short time from now. So I think the important messaging for people is that we know that there will come a time where we have a surge. Our goal in all the things we're doing is to try and make the peak of that in terms of the number needing care at one time as low as possible. And when we have some meaningful information for people to share that we actually think has some good long-term predictive value, we can help to share that.
Okay. We're seeing different reactions of different people to the virus.
Mm-hmm.
Why is that? Why are individuals' responses varying?
Well, I think people can compare that to, for instance, flu. I think we're all aware that, we have, friends or family members, even within the same household, who one person gets influenza and they are just, out of commission for a week or 10 days with the severity of the symptoms, and then other individuals in the household have very mild and transient. It's just, part of the way our own immune system reacts, part of the vulnerabilities that we have as individuals that make one person's reaction a little bit different than another. But certainly people are right. There's a real spectrum of illness in this. And what's different from flu with this organism is that it does appear to be more easily transmitted. And there certainly is a larger group of individuals who seem to get more significant illness. And so that's what's requiring a lot of these efforts on our part, is expecting that more people will get more seriously ill than we would normally see. And the fact that, of course, none of us have underlying immunity to this virus. And so everybody is at risk to get infected. During flu season, we're able to decrease those numbers substantially because of vaccination.
And then the last question, there's been some questions about syringe exchange programs locally, and if they're considered an essential service. Is DHHS continuing to run its syringe exchange program?
Sure. So I absolutely consider it an essential service. It is a public health service that decreases risk for everyone, including the individuals who use the service. So, that part is clear. The health department has operated syringe service programs, and last week we were doing a modified version because of staffing issues, and this week we are not able to offer them because, frankly, we're pulling every bit of our staff possible into this COVID response. I'm thankful that Hatcher has been able to continue services and maintain those for the public, and we're really we understand that puts some additional burden on them and some decrease for community members, but we simply need the depth on the bench right now in our other operations.
Excellent. Well, thank you so much.
Thank you.